She first felt it on an ordinary morning. No pain, no drama. Just a small, unfamiliar change she almost ignored. Life was busy, responsibilities loud, and fear was inconvenient. Like many people, she told herself, it's probably nothing. Days turned into weeks, weeks into months. And yet, that quiet change stayed, patiently waiting to be noticed. This is how breast cancer often enters a life not with thunder, but with silence. Breast cancer does not announce itself clearly at first. Sometimes it begins as a small lump, sometimes as a subtle thickening, a change in skin texture, redness, dimpling, or a nipple that looks or feels different. In some cases, there is discharge, swelling, or unexplained pain. And sometimes there are no obvious signs at all. That's why awareness matters so deeply. Knowing your own body, paying attention to changes, and not dismissing your instincts can save years and lives. The word cancer carries weight. It arrives heavy with fear, uncertainty, and stories we've heard since childhood. But breast cancer today is not the same disease it was decades ago. Medicine has changed. Science has moved forward. Survival is no longer rare. Hope is no longer imaginary. Early detection alone has transformed outcomes dramatically. When found early, breast cancer is often highly treatable. And many people go on to live long, healthy, meaningful lives. Prevention docen. T always mean complete avoidance because not all cancers are preventable, but it does mean reducing risk and increasing control. A healthy lifestyle plays a powerful role. Regular physical activity helps regulate hormones and strengthens the immune system. Even simple habits like daily walking can make a difference. Maintaining a healthy weight is important, especially after menopause. BEC-AUSE excess fat tissue can increase estrogen levels, which may fuel certain breast cancers. Food, too, becomes more than fuel, it becomes protection. Diets rich in vegetables, fruits, whole grains, legumes, nuts, and seeds provide antioxidants that help protect cells from damage. Foods like broccoli, cauliflower, spinach, berries, tomatoes, turmeric, garlic, green tea, and olive oil have been studied for their protective properties. Reducing processed foods, excess sugar, and unhealthy fats lowers inflammation in the body. Alcohol intake, even in small amounts, has been linked to increased breast cancer risk. So limiting or avoiding it is a powerful preventive choice. Lifestyle choices echo quietly over time. Smoking introduces toxins that damage DNA and weaken the body's natural defenses. Chronic stress, poor sleep, and inactivity slowly chip away at immunity. On the other hand, rest, movement, laughter, emotional support, and purpose strengthen the body in ways science is still learning to fully explain. Health is not built in one day, it is shaped by thousands of small decisions. Screening remains one of the strongest tools we have. Regular self-exams help people recognize what is normal for them. Clinical exams and mammograms can detect changes long before symptoms appear. For those with family history or genetic risk, earlier and more frequent screening may be life-saving. Awareness is not fear, it is power. Treatment, once terrifyingly limited, is now deeply personalized. Surgery today is often less invasive, aiming to remove disease while preserving quality of life. Chemotherapy has become more targeted, reducing damage to healthy cells. Radiation therapy is more precise than ever. Hormone therapies block the signals that certain cancers need to grow. Immunotherapy trains the body's own immune system to recognize and destroy cancer cells. Targeted therapies attack specific genetic weaknesses within tumors, making treatment smarter and more effective. And the progress does not stop there. Advances in genetic testing now help doctors predict which treatments will work best for each individual. Artificial intelligence assists in earlier detection and more accurate diagnosis. Liquid biopsies, simple blood tests are being developed to detect cancer DNA circulating in the bloodstream. Sometimes even before tumors are visible. Vaccines designed to prevent cancer recurrence are in clinical trials. What once sounded like science fiction is slowly becoming reality. But treatment is not only medical. Healing is emotional, mental, and spiritual. A diagnosis changes how a person sees time, relationships, and priorities. Fear may arrive first, but it is often followed by courage people never knew they had. Support from family, friends, survivors, and healthcare teams becomes a powerful medicine. Stories of others who have walked the same path remind patients they are not alone. Food during treatment becomes a source of strength. Nourishing meals help the body tolerate therapy, rebuild tissues, and maintain energy. Protein supports healing. Hydration supports detoxification. Gentle anti-inflammatory foods help reduce side effects. There is no single cancer diet, but there is wisdom in listening to the body and choosing nourishment over restriction. Movement, even gentle stretching or short walks, can reduce fatigue, improve mood, and speed recovery. Mindfulness, prayer, meditation, and gratitude practices have been shown to lower stress hormones and improve overall well-being. Healing is not just about surviving. It is about living fully, even in uncertainty. Perhaps the most powerful truth about breast cancer today is this: survival is no longer the exception, it is increasingly the expectation. Millions of people around the world are living proof. Survivors become advocates, educators, and symbols of resilience. They return to work, raise families, chase dreams, and create meaning that goes far beyond illness. And then there is the hope of cure, not as a distant dream, but as a future actively being built. Each year, survival rates improve. Each year, treatments become less harsh and more precise. Each year, research brings us closer to understanding cancer, not as an unbeatable enemy, but as a complex problem with solutions. The story doesn't end when treatment ends. Life after cancer carries its own lessons. There is a deeper appreciation for ordinary days, a sharper awareness of what truly matters. Many survivors describe a quiet transformation, a shift from fear to gratitude, from urgency to purpose. Cancer may change a life, but it does not define it. In the end, breast cancer is not just a story of disease. It is a story of awareness replacing ignorance, science replacing fear, and hope replacing despair. It is a reminder that the human body is resilient, the human spirit is stronger than we imagine, and progress is real. And here is the most important part of this story. If you are listening to this and worrying about yourself or someone you love, remember this: early action saves lives, healthy choices matter, and help is always closer than it feels. The future of breast cancer is not darkness. It is light, knowledge, and hope, growing stronger every day. Because sometimes what begins as a small, quiet change becomes the moment that awakens us not to fear life, but to protect it, value it, and live it more fully than ever before.